So we're going to talk about how to use incentive spirometers today. So incentive spirometry is a form of lung volume expansion, and it's used for patients who are at risk for atelectasis. Those include patients that are immobile or patients that have just had a abdominal or thoracic surgery. And so to use an incentive spirometer, first we need to use a respirometer to see what the patient's tidal volume is and inspirational capacity. And then what we're going to do is assess the patient. We're going to get their respiratory rate, we're going to get their breath sounds, their heart rate, etc. And then what we're going to do is we're going to instruct our patient on how to use the incentive spirometer. So that's what this device is. And to use this, what we're going to do is instruct our patient to exhale fully, and then they're going to wrap their lips around the mouthpiece, and they're going to inhale slowly and deeply for as long as possible, at which point they're going to hold their breath for 3 to 5 seconds or until they can't hold it any longer, and then they'll exhale. And they'll repeat this process 10 times per hour. Now, each person's goal is different. So the goal is based on the patient's age, height, and gender. And that's how we determine the goal. So inside each spirometer packet, you have a little guide to help you determine what the goal will be. So when the patient breathes in, this white float will rise toward their goal, and then this float will also rise, and we'd like for it to be between better and best. And so we'll instruct the patient and coach them on how to use the spirometer. And then once they've finished their treatment, we'll have them take a deep breath in and cough, which will help mobilize secretions. And then we'll also do a final assessment. So we'll listen to the breath sounds again. We will get their heart rate, their respiratory rate. We'll get their vitals, and we'll see if this treatment is helping them in any way. If not, then we need to look toward other forms of lung volume expansion.